beauty is in the details because plastic surgery is now really all about the millimeters and not about the centimeters.
I'm your host, Ariana, and this is Hot Girls Have. Hello and welcome back to Hot Girls Have. Okay, we've all heard that you can get a nose job without Botox. Is this true? Maybe you've wondered what a little filler here or there would do, but you're a little bit nervous about the long-term effects. Have you ever heard of a global facial optimization? Yes, it's a real thing. Today I'm talking to Dr. Lara Devgan, a top board-certified plastic surgeon in New York City, renowned for her expertise. We'll be talking all things plastic surgery, what it means to optimize your face, and why Gen Z is helping to change the industry. Dr. Devgan, welcome.
Thank you so much for having me. What a treat.
Let's dive right in. You are known for doing what is called a quote-unquote global facial optimization. I want to hear all the tea about this. So what is this? Why do it? How expensive is it? And who's doing it? Like, who is getting this done?
Well, I think the way we think about plastic surgery is grossly misunderstood. People think about it in the LA entertainment television way, where
Totally
it's
agree.
overly puffed up lips,
Right.
exaggerated puffy cheekbones, big, gigantic, oversized breasts and buttocks. And, it's kind of a caricature of Jessica Rabbit.
Yes.
But in the real world, plastic surgery is actually an incredibly subtle academic and anatomy-based modality. And it's a way that we can help people of all stripes feel a little bit more confident. So I say that as a background because I coined the term facial optimization or global facial optimization about 10 years ago, because I think a lot about what we see when we look at a Snapchat filter or when we do a little Facetune app. And what we see is not that all of a sudden our lips become gigantic or our cheeks become puffy, but what we see is the power of many tiny millimeter level changes all over the face, applied in a way so as to bring out our best characteristics and minimize or send to the background some of the less flattering ones. So in a nutshell,
Fascinating. Oh my gosh.
it's thinking about aesthetics through the lens of both art and anatomy and looking at each face. And this is one of my favorite parts of my job, looking at every single face, finding the beautiful features in that face and bringing them to the forefront with a combination of both surgery and non-surgical modality. My background is as a plastic and reconstructive surgeon. That is soup to nuts, every age group from infants to the elderly, male, female, everyone at every demographic that you can imagine. I see patients from all over the world. And in plastic and reconstructive surgery, there's a huge functional element. So it also includes things like cleft lip and palate, breast reconstruction, burn reconstruction,
Right.
putting together facial fractures for someone who's been in a traumatic accident, war injury reconstruction, hand fractures, replantation, face transplants. It's an extremely broad and amazing field. When we look at some of those techniques and how we can apply them to plastic surgery, yes, I do have patients who come in and say, oh, I saw your viral Instagram reel or TikTok video and I want that. Help me. What do I do? But I also have patients who are much more deliberate and stepwise in their approach for facial optimization. Every patient is different. So the way I think about it is it's like commissioning an artist to make a very beautiful and special, cherished work of art for you. So it starts with a conversation,
Right.
a facial analysis, a summary of possible approaches. You want to think about person-specific factors like, are you 27 years old and this is your first time doing baby Botox and you want your eyebrows more symmetrical? Or are you 70 years old and you're noticing some laxity of your neck, hooding of your eyelids, you want a full surgical procedure? Or many of my patients are somewhere in the middle, 20s, 30s, 40s, 50s, kind of some combination of those little things. So the expense, the downtime, all of that is highly variable. And over the past 5 to 10 years, my practice has focused a lot on people who want this global approach. And, a lot of celebrities, A-listers, people who have public-facing jobs and roles, and where a millimeter really shows up on camera and where that really counts.
Do you think First of all, that's so fascinating. I think this entire conversation is so fascinating because we are talking literally millimeters. Yes, millimeters make a huge difference. So, going back to this concept of filters and Snapchat and whatnot, do you think that this really caught on? Because you said you coined it 10 years ago. Do you think this really caught on because of the world of filters and social media and people going online, putting a filter on their face and saying, oh my gosh, I actually really like how this looks? Like, I didn't realize how insecure I was about this thing, and seeing myself with, XYZ, I feel so much more confident.
I think social media has a tremendous power, not just for showing us the power of tiny little changes like that, but also for amplifying information. And there are good and bad ways to use Instagram or TikTok or
Definitely agree with that.
Facebook or, Twitter, X, Threads, all of the above. Be real.
Hmm.
There's so many things out there now, and they're good and bad ways that they can affect people of all ages. I think on one hand, they have demystified and taken down the veil
Hmm.
that has historically covered plastic surgery as an industry. We used to think that these procedures were reserved for the most famous celebrities and the wealthiest people in the world. And now we see on our feeds that our friends and neighbors and colleagues at work are doing a little Botox or filler or having a little, subtle rhinoplasty or breast augmentation, body contouring procedure. So, demystification and sharing information. But number two, I think they've also made beauty standards much more globalized. So, they've allowed us to see what other people are doing. And it's much less of an archetype of only one kind of person belongs on the cover of a magazine. Now we're in an era where anyone can be on the cover of a magazine. You can be 50 years old and be the star of the magazine. And I've
Hmm.
had some patients who have been in that position.
Hmm.
And
All
so
shapes, all sizes, all
yeah,
colors,
and
all
I think that
backgrounds.
has really
I agree.
democratized beauty. And then finally, really specifically to your point in your question, I do think sometimes it has changed the way people think about what they want from plastic surgery. I would say 5 years ago, patients would bring in inspiration images of their favorite celebrity, like I want breasts like this or lips like that. And now people are much more likely to bring in a slightly edited version of their own face or body, which
Wow.
is in a way, anchoring a little bit more to what's realistic and can be more self-centering.
Right. Okay, that makes a ton of sense. I want to dive into a couple of trends going on right now. So, the latest it trend is the no surgery nose job. I've seen a lot of TikTok videos about how this is insanely dangerous. And I know that social media is not the best place to get information. So, I'd love to hear from you. Is this as dangerous as it sounds? Is this really not a big deal? Like, what are your thoughts on it?
I think that we have opened up the wild west of plastic surgery where, I'm coming from a very traditional educational background at Yale, Johns Hopkins, an MPH, National Institutes of Health, Columbia, Cornell, New York Presbyterian Hospital. I did a full plastic and reconstructive surgery residency, fellowship, board certification. And now we've opened up the
That
floodgates
was such a drop
because
mic moment. I'm just going to say that was
yeah. Okay.
incredible.
I don't say that to sound as annoying as I'm
No,
sure
no,
I'm
not at
sure it
all.
sounded. I say that to discuss this idea that as the industry has opened up so much, there's so much more demand that people with vastly different qualifications and backgrounds are sticking sharp objects into other people's
Yes.
faces.
Yes.
And we need to really take pause and take inventory because the rules that govern plastic surgery and medical aesthetics, even little, quote, little things like Botox, those rules have not kept pace with the inherent danger and difficulty and seriousness of the procedure. So, in some states and countries, there's almost no barrier to entry.
Really?
And in others, it's a little bit more strict. But on the topic of non surgical rhinoplasty,
Hmm.
that is one of my favorite and most frequently performed procedures. I will say that the only reason that I feel comfortable doing so many non surgical rhinoplasties is because I've done so many surgical rhinoplasties. And
I see.
having the three-dimensional anatomy and visualization of the entire blood vessel network that perfuses the nose is what allows me to understand in real life three-dimensional space where product is being placed and how to keep someone safe. if you go to a random med spa or pop-up shop
Yep.
and have a random person with minimal training and background who's never
Who's
done a
never done a
surgical
surgical one? Right.
never done a surgical rhinoplasty, what confidence can you have that they will not inject into your central retinal artery or a vessel that anastomosis with it and make you permanently blind? Or cause
Wow.
tissue necrosis and have the tip of your nose fall off. Like, the consequences are very, very real.
Mm.
That being said, I've done over 20,000 non-surgical rhinoplasties. I believe that's more than anyone in the
Oh
world.
my god.
And I think that in safe, excellent, judicious, judgment-oriented hands, in the right person's hands, it can be an incredible and
Mhm.
such a beautiful procedure.
Ultimately, it's dangerous if depending on who you get it from and what their qualifications are. Just like any other surgery, which I think is something that people forget. Like, even though it's non-surgical, yes, this is still something that takes some serious qualification and skill.
Yeah, I think that as people become more comfortable with the idea of plastic surgery, they somehow feel that it is less serious and
Right.
that a lower degree of
Oh, it's
qualification is
non-surgical.
needed.
It's okay. It's
Right.
whatever. I can just go to the med spa down the
But
street.
if your
Whatever.
mom or dad gets a stent in their heart for a heart attack instead of an open heart surgery, you don't want a totally random person to be doing that. You still want a similar level of training and expertise.
Right.
So with technology, we're doing less and less invasive approaches using the same deeply invasive knowledge of anatomy. So, non surgical rhinoplasty is an incredibly safe and effective procedure in the right hands, but that's a gigantic asterisk.
Large asterisk.
Yeah, that's a really big asterisk. And
Mhm.
I have seen and taken care of many people who've had problems in the wrong hands.
Tell me, just generally speaking, what are you seeing that's in for plastic surgery and what's kind of out nowadays?
I think what's in is the return of subtlety. I think
Ah,
the
I love that
exaggerated
sentence. Oh my gosh, I'm so glad to hear you say that.
yeah,
Yes.
what's in is really the return of subtlety.
Mhm.
And I like to say that subtle is the new dramatic and beauty is in the details because plastic surgery is now really all about the millimeters and not about the centimeters.
It's enhancing your own beauty.
It
It's
is.
let's highlight why you're beautiful and okay, love that.
Exactly.
That I feel like that kind of lends itself to that like no makeup look that everybody's doing as well in the
Yeah.
makeup world. Like natural is beautiful. We like just look the way you do and it's okay.
Yes. And I think that no makeup is actually the perfect way to explain this idea of facial optimization because you might need 10 or 15 products to create a good no
Right.
makeup look.
Exactly.
Whereas you could easily see someone with just one garish blue eyeshadow
Mhm.
being minimalistic, but yet overdoing it. And so I think aesthetic judgment is the new state of the art. I think consumers are becoming much more educated and subtlety, smaller size breast implants, a rhinoplasty, surgical or not, that preserves some ethnic characteristics of your parents or ancestors or identity. You know, procedures that overall help enhance who a person is instead of making them into someone else.
What is a procedure you'd advise your own family against? In other words, like something that has maybe a lot of risk involved?
Yeah. One procedure that I stopped doing and that I no longer perform is autologous fat grafting to the buttocks in particular. So sometimes people call this BBL or Brazilian butt lift.
Mhm.
And it was a procedure that really boomed in the, I would say, 2010 to 2015 era, even a little beyond that, because it was very in with a lot of public figures to have a really exaggerated physique.
Mhm.
BBL is associated with an extremely high mortality rate. And in some studies, it has
Really?
been published as high as 1 in 3,000. So to
Oh
me,
my
yeah,
gosh.
to me, that is not a risk that's worth taking for any elective procedure.
No. Why
And
why is the mortality rate so high?
when fat is injected deeply below the muscular substructure of the buttocks, there can be a risk of fat embolization, which can cause a pulmonary embolus, which is a
Wow.
gigantic blood clot, and that can be a fatal event. And so, a lot of my colleagues are doing a lot of really great work to make this as a procedure safer, and there are many ways to reduce risk. But given that we have other safer alternatives like non-surgical buttock augmentation with poly-L-lactic acid and other, basically you can use collagen biostimulators to get a similar effect.
Mm-hmm.
It's just a procedure that no longer has a home in my practice.
Yeah, it sounds like it shouldn't really have a home in a lot of practices.
I agree
might
with you.
say,
I
generally
totally
speaking.
agree with you, and it's something that I wouldn't want a family member of mine to do. And
Mhm.
that's actually my litmus test for everything that I do in my practice. If it's not something that I would do or I would have my mom or dad or sister or brother do,
Mhm.
then it's not something that I want my patients to be doing.
In your opinion, what do you think makes a quote unquote good plastic surgeon? And like what are some things that you should be asking in your consultation to be aware of this? And maybe what are some red flags that people should look out for?
Yes, great question. A great plastic surgeon is someone who not only aligns with your goals aesthetically, but someone who has an appropriate training background. And this is just something that should go without saying, but a plastic surgeon has to be board certified by the American Board of Plastic Surgery. And if they're not, they've really taken some kind of shortcut or
There's a
battle
loophole somewhere in
they've
there that they've
battlefield promoted themselves to a level of qualification that doesn't exist. But
taken.
there's exactly one way to become a legitimate plastic surgeon in the United States, and that's kind of carried over to other parts of the world as well. But the American Board of Plastic Surgery is the credentialing body. Once you find yourself a board certified plastic surgeon, you want to make sure that that person's aesthetic aligns with your own.
Right.
And it's like Matisse and Picasso and Monet. Who's better? Well, it depends who you ask, and it
Mhm.
depends what you gravitate towards. So
So is
there
that like a look at the maybe transformational
Look,
photos
yeah, look
and
at the before and
see what
after
they're
photos,
doing?
see what people are doing, see what kind of information they're putting out into the world. I think trying to understand if you click with someone and if you can really have that relationship of commissioning an artist and you're the client, and it's a collaborative effort. So you need to click with the surgeon and the surgeon needs to click with you. And then I think understanding the whole process. It's like going to a restaurant. If you like the experience, if you feel like it's for you, there are a lot of places where you can get a really great slice of pizza in New York City,
Right.
but maybe one is your favorite for a combination of all of those reasons.
I like that you speak to plastic surgeons being artists and that this is something where clicking with them is so important because I feel like this industry is definitely different than a lot of other industries where like if I tear my ACL, I can go to one of the best ACL surgeons in my city. I don't really have to get along well with them in the room and I don't really need to see the before and after pictures to know that okay, they're going to do their thing. It's okay. This on the other hand, it's such a personal journey. It's such a personal experience. Aesthetics are like everybody has a different flair and a different spin that they do on things. So I'm curious, what would you say is kind of your take on I don't know if that's even like a
Yeah, like
proper
what's my
question.
style?
Yeah, what's your style?
I really love minuscule details. So
Well, I know your phrase is beauty is in the
beauties and the
details.
details. That's
I
kind of
love
like,
that.
I love that plastic surgery affords us the ability to use many different tools in our toolbox to combine from topicals, lasers, microneedling, injectables, Botox filler, suture suspension, and full, more invasive surgery. And think of each patient and each situation in a way that will help them. So I would say that my style is I love classical harmony. I love proportions and balance.
Mm.
I love understated elegance. I love tiny little details.
Mhm.
And I like the coherence of one anatomic area with its adjacent anatomic area and making it all work together.
What's one of your favorite procedures to do?
Surgically, I love facelift, eyelid surgery, and small volume breast augmentation.
Mm.
And non-surgically, I love profile balancing, which includes non-surgical rhinoplasty. And I really think that the tear trough and cheekbone jawline, I think this is a very underappreciated part of the face. So I'm very into technology
I
and
love that.
using the most modern techniques with this very traditional training to try to achieve the most beautiful outcomes for my patients. And I like the customization part of it.
Mm-hmm.
So I can create a lot of different kinds of things. And having that long term relationship with people is fun for me.
What is a piece of technology that you're really excited about right now that's either coming and going to be in the plastic surgery scene soon, or maybe just got released, or maybe you've just started using it, or I'm curious.
Yeah, I love erbium laser to resurface the skin. It's kind of like beautiful control alt delete for the skin. And while the concept of lasers is very old fashioned, it's not new at all before I was born. Um,
So like 20
the
years ago.
like 20 or 25 years ago, the execution improves and improves over time, like the way every iPhone is a little smaller and
Mm,
faster than the generation that came before, and the
hmm.
camera's better. So,
So what kind of laser is it then?
so it's an ablative resurfacing laser that's
Okay.
just really beautiful for pigment, fine lines, and collagen induction.
Botox, injectables, lasers. Like, do you wish that these things maybe had a bit of a longer time frame to them, or do you like kind of the time frame that they work?
I think there's something annoying about maintaining everything,
Right.
whether it's your haircut, your Botox, or how frequently you have to get your tires rotated.
Mm-hmm.
You know, there is always going to be a frustration with maintenance, but I think there is a happy medium period where over the course of 2 to 4 years, there are major structural changes where you don't want stuff to last for too long. However, getting things to last a little bit longer would save a little time.
Right. Tell me a little bit about the age group for plastic surgery. Like, I know that, and we'll get into this a little bit later about Gen Z and social media, and I know we kind of talked about it before, but I'm just curious, who should really be the target age group that's thinking about plastic surgery, and what's kind of too young, what's a little bit too old? Obviously, this is totally a generalization, but I'm curious.
It really depends on your anatomy and goals more than your calendar age, because what we do is so bespoke. So, my oldest patient for surgery has been 86, and my youngest patient has been, you know, early teens in the care of their parents.
Mm,
And for something like a surgical procedure for the face, if it's not reconstructive in nature and is purely cosmetic, you want to wait for facial maturity, which can be over 16 to 18 in women and around that age group for men, sometimes a little bit older. But I think you don't want to make a permanent change to your face until your face is mature. For things like anti aging, this is something that we're seeing a lot with higher profile and celebrity clientele. Tiny procedures done at younger ages can have a greater impact than a big major overhaul when
right.
you're older. So, facelifts in your 40s instead of in your 50s or 60s. And then you look the same for a really long period of time. I think there are so many X factors here that it's so patient specific. There's a whole
Hmm.
topic around childbearing, where some procedures people would want to do before that, some they might want to do afterward. And so, this is part of the consultative process with the patient. I really seek to understand a person and their unique goals
Hmm.
and then come up with a big picture plan for them.
Now I kind of want to talk about how you helped contribute to this Washington Post article. And it was all about how Gen Z has had work done and isn't afraid to share it. We kind of touched on this a little bit earlier in this episode, but I think I'm curious on your thoughts. I think this is a really fascinating conversation.
It is cool to be able to share what you do with people. And it used to be just taking a picture of your spicy rigatoni that, that's what
Right.
you need to do on your Instagram feed. And now it's more like taking a picture of your first Botox
Hmm.
and sharing the experience of your breast lift surgery or your tummy tuck.
And it used to be so hush hush. Like, so many people were embarrassed to share that they had something done. And now the article basically details how Gen Z is ready to share loud and proud. Hey, I had this done. Check it out. Do you like it? Oh my gosh, so exciting. what are your thoughts on that moving forward with this new generation coming into play? Like, do you think plastic surgery is going to go a different route? Do you think that people are going to ask for different things? Do you think, I don't know, I'm so curious.
Yeah. I hope that I think there's something great that comes out of social sharing. I think it really takes down barriers and destigmatizes procedures that sometimes really trouble people for a very long time. I think also, though, that I hope it doesn't minimize the seriousness of the risks and benefits involved, because the last thing we would want would be a frivolity about
Right,
surgery, which
right.
is still a real deal,
Hmm.
and it's still the real thing and a big decision for a person to make.
I want to get personal now.
Okay.
Tell me about your routine. What are some must have products, and what are some products that you would never use?
I founded, as you know, my skincare line,
Hmm.
Dr. Lara Devgan Scientific Beauty, which is retailed all over nationally and internationally. And those are the products that I literally swear by. Actually, you saw me putting
Oh,
some
yes.
on before the podcast when I found out we were taping this visually. So I never am too far from my own skincare routine. But
Hmm.
okay, buckle up, get a pencil.
I'm
This
ready.
is my routine.
I'm so ready.
Okay, in the morning, I like to wash my face with my advanced revitalizing cleanser. I apply my hyaluronic serum, which it is so good. If there's literally one thing that you remember, our hyaluronic serum is a mixed molecular weight niacinamide fortified hyaluronic, so it really boosts collagen. It literally will transform your skin and make it look so amazing, like a beautiful glossy skin.
Oh my gosh.
Um,
I'm like googly eyed right
on
now. Your skin is gorgeous. So,
On
like, I
top
will be
of
getting this.
that, I like to use my peptide eye cream because the tissue around the eyes is so delicate, that whole periorbital area.
Hmm.
So our peptide eye cream is amazing for rejuvenating and restoring this whole area and preventing stigmata of fine lines and aging related problems. And then I like my SPF BB cream because it's a tinted moisturizer BB cream and SPF all in one. So it's,
Love
I'm a
it.
busy
Yes.
person
Yes.
and I don't have time for a lot of stuff.
Hmm.
So that's important to me. And then Platinum Long Lash, which is our lash serum. It's really great for keeping your lash health intact and growing your lashes.
Yeah,
So
your lashes don't look real. Like, those are amazing.
that's
Oh my
Platinum
gosh.
Long Lash
Oh my
and
gosh.
Extreme Lengthening Mascara. And then I'm wearing our lip plump. That's like kind of my morning routine. So my night routine is vitamin C, BE, ferulic, retinol, bakuchiol,
Hmm.
and those are really great for hyperpigmentation, evening color, evening fine lines. And then every other day, I'll do some exfoliation of my skin. So either with microdermabrasion scrub or chemical exfoliation with alpha beta hydroxy pads. On top, when I'm a little dry, I'll use our resveratrol night cream and niacin squalene night cream. So that's like my full routine
Incredible.
for real.
So, products that you would never use.
I think generally people tend to be too harsh with their skin. So over stripping the skin.
Okay.
I have never found the need for a toner. I think that that is just a genre of product that doesn't have a clear role.
Hmm.
I think you can cleanse your face, you can microdermabrasion it, you can chemically exfoliate, but a toner I think is not needed for me.
Hmm.
Um, I don't like harsh products that are overly stripping. Um, and I think that we're trending much more toward physical sunscreens that are zinc and titanium based. So chemical based sunscreens are much less valuable for us.
Okay. Have you ever had anything done?
Yes, I do my own I do my own injectables. So I do my own Botox 4 times a year. I love my
Oh, how
gold micro
cool. Oh my
infusion facial.
gosh.
Yeah. Gold micro infusion facial, which is really beautiful for boosting collagen. I do that quarterly also. I do erbium laser resurfacing twice a year, and then just like little mini judicious injectables when needed.
Hmm.
But I like this idea that less is more. If you want to keep looking the same, though, it does require a little bit of intervention over time.
Right. Very fair. So, we love ending every episode with one takeaway that listeners can drop in their group chats today. What is yours?
My takeaway is that subtle is the new dramatic and that beauty is in the millimeters, not the centimeters. So when you think about plastic surgery as a concept and genre, don't think of the exaggerated features and the puffy, weird looking people in restaurants all over this town and towns just like it. What you want to realize is that the best work is the work that you don't see. And that the goal is really to feel like the better version of yourself, not like somebody else. So ultimately, everything that I do is related more to identity than physical beauty. And I think that's something that we all should take home, that,
Mhm.
leaning into who you really are. If there's a safe, medically responsible intervention that is going to make you feel a little bit better or walk with a little bounce in your step or feel a little more confident, for me personally, that has helped me engage better as not only a doctor and surgeon, but as a wife, a mother to 6 young children, somebody who talks to people all day long. It's good to feel good in your skin.
Mhm.
And I think that understanding what can be offered by this field while still appreciating the seriousness and risk benefit involved, that's that's the future of plastic surgery.
So beautifully said. Dr. Devgan, thank you so much for being here. This was awesome.
Thank you.
Thank you so much for joining us on today's episode of Hot Girls Have. You can find anything we mentioned in our show notes. Want more? Visit our website or check out our social media. This podcast is brought to you by Belly Welly, leading the charge in women's gut health.